Hi there, Jeff Kenkel. I'm really happy to introduce our June issue for Aesthetic Surgery Journal Open Forum. We've got 4 new articles. 3 of them have accompanying videos, which I think are going to nicely complement the written form. The first article is by Dr. Shui from China, and it's called An Innovative Approach for Facial Rejuvenation and Contouring Injections in Asian Patients. You know, there's nothing more important than clinical analysis. So however means you have to assess patients will really direct what their care is. And I think this group has put together an interesting and novel way to assess patients for facial injections, both largely for fillers. It does come with an accompanying video, which I have found very helpful. So I really encourage you to check it out. In the breast surgery catalog, Dr. Hausch et al. Has an article entitled Subpectoral Implant Repositioning with Partial Capsule Preservation, Treating the Long-Term Complications of Subglandular Breast Augmentation. Again, I think this is a nice review of a group's experience using a slightly different technique than what we've been taught. This is a retrospective review over a 6-year period of time, looking at about 24 patients, and has an accompanying technical video associated with it. So I think it's just an interesting way to approach a problem that we all see on a daily basis. Our next paper in the rhinoplasty section is dealing with an interesting topic of autologous fat transfer to the nose. And this is a systematic review from Dr. Kean et al. And what they did is they looked at a systematic review that encompassed about 560 patients and came up with some guidelines about how best to use fat, particularly in rhinoplasty. I think the review really stressed that this is a safe procedure when done correctly, and has some really good information if this is something that you would like to bring into your practice. And in our last category of body contouring, Dr. Rich Restifo has published an abdominoplasty in the massive weight loss patient. Are aesthetic goals and safety mutually exclusive? And Rich has a tremendous experience with body contouring. And in this paper, he retrospectively reviewed 910 patients that were divided into several groups, including postpartum, dietary weight loss, and then bariatric weight loss. And he was able to compare the cohorts and came up with some really nice conclusions. It has an accompanying video with it. So I think all of us take care of body contouring patients, various different sizes and shapes, and I think Rich has nicely summarized his tremendous experience. Several of these articles have accompanying commentary associated with them. They're video commentaries, so again, I'd look for those, which will really kind of bring everything together. We're really excited. We're getting more and more submissions, so we hope you enjoy the June issue.